Miss Shelby. My name is Donna, and I'm here today to do an assessment. We'll be doing a musculoskeletal assessment on you. We're going to look at Shelby because she has a history of scoliosis. They said they've got your height and weight, that you're 4'2" and weigh 96 pounds. That's very good. Can you tell me how old you are, Shelby?
10.
Do you have any allergies? Are you allergic to anything?
No.
No? Is that right, Mom?
Yes, ma'am.
And do you take any medications? Okay. And is that correct, Mother?
Yes, ma'am.
Okay. Any other history? Do you have asthma, diabetes, any other kind of health problems? Okay. And have you had any fractures or broken bones before? Okay. Tell me about that. Where did you have a fracture at? Right there on your hand? Okay. Did you have to wear a cast, or has that been very long ago? No. Does it hurt? Cause you any pain? Cramps? Okay. Do you hurt anywhere else when you move? Okay. And do you play any type of sports? Okay. I will be right back, Miss Shelby. I'm gonna go wash my hands and we'll start our assessment, okay? All right, Miss Shelby, I am back. I am going to start, we're going to check all of your joints. So I'm going to start by looking at your jaw, and then we'll look at your shoulders and your elbows and your wrist, and then your hips, knees, and ankles, okay? And then we'll look at your back last. It's important for students to remember to always introduce yourself to the child, have the parents present for your assessment, and let them know what you're going to do before you do it. So Miss Shelby, I'm going to just look right here, right in front of your ears, and then I'm going to touch, okay? And we're just feeling for any knots. Okay, can you open your jaw for me? Okay, and then can you move it from side to side? Very good. Does that hurt anywhere? Okay. Then I'm going to look at your neck. I'm going to come here back behind you. And we're just looking at your cervical spine to see if it's straight. Okay. Any pain back here when I touch you?
No.
Okay. And with your spine, tilt your head down toward your chest. Okay. Look up toward the ceiling. Okay. And then look to your right. This way. Okay. And then turn your head to the other way. Okay. And back to the center. Right. And then tilt your head to your ear toward your shoulder. Okay. And then the other side. Very good. All right. And I'm going to just look at your shoulders. I'm sorry, my hands are cold. Does that hurt any? Okay. Bring your arms up for me. Okay. And lift them up above your head with your fingertips touching. Okay. And bring them back down. And then reach backwards for me. Does any of that hurt? Cause you any pain? Okay. Next, we're going to look at your elbows and then your wrist and your hands. Any pain when I touch you there? Okay. Let's look at this side. And we're just looking for any knots, any nodules, anything that feels abnormal. Okay. And then with your elbows, take your arms all the way up for me and bend them up for me. Okay. And back down. Okay. And then bend it up for me and let it like you're making a muscle. Okay. Can you pull toward your body for me? Okay. And then push back toward me. Very good. Okay. This arm, pull toward you. Okay. And then push toward me. Very, very good. All right. And then tilt your elbows up and down. Okay. Can you go side to side? Does that hurt any? Okay. And then with your fingers, all right, make a fist for me. Okay. And can you make them go down? Very good. And then touch your thumb to each finger. Any trouble doing that? Okay. Now I'm going to get you to lay on your back for me, and we're going to check out your hips, okay? Very good. You okay? All right. Any pain in your hips? All right, raise this leg all the way up for me. Okay, and back down. Okay, and then bend your knee up towards your chest. All right, and I'm gonna just move your leg in a little bit, and then out. Does that hurt? Okay, we'll do the same thing to the other side. Up, okay, back down. Okay, and then pull it in towards your chest for me. Okay, and then I'm gonna move it in and out. Okay, and back down. Doesn't hurt at all. Okay, and then I'm gonna just feel your knees. I'm gonna move your kneecap around. Can you feel that? Okay. Get down here and look at your feet, and I'm gonna feel for a pulse in your foot. That checks for circulation. Okay, now can you move your foot up toward you, like you're going, there you go, up towards your nose, and then point it out for me. Okay, and then this foot. Okay, can you turn them side to side for me? Okay, any pain at all? Okay, and then can you move your toes for me? Very good. All right, now I'm gonna get you to stand up and we're gonna take a look at your back, okay? Here we go. And Shelby does have a history of scoliosis, and we're just looking as far as hip height to see if one hip is a little higher than the other. And it looks like her right hip may be just a little higher than the left. And then you can also look at the rib cage to see if it's symmetrical or not. And I'm going to take a marker and we'll mark her back so we can see the curvature of her spine. We have finished marking Shelby's back, so you can see this. You just fill up and mark the spinous processes, and you can tell where she has got this curvature in her back. And this is referred to as scoliosis, which she may or may not outgrow. All right, Miss Shelby, you can have a seat for me. And I want to thank you very much for letting us do our assessment on you today. Now, Mom, do you have any questions about her scoliosis?
You did say it was something that she could possibly outgrow.
It is. She may outgrow it, and it varies from one child to the other. It may continue to be more significant as she gets older. Right now, the doctor just wants to continue to observe her, and they'll bring her in every 6 months, and they'll look at the curvature of her spine and see if it's getting worse or if it's straightening out as she grows. There are treatments for it if it gets more significant as she gets older. There's some back braces that they can put her in that will help her spine to straighten out as it grows. And then, of course, in very severe cases, there are surgeries that is a possibility in the future. But typically they wait until they're later in the teen years to see, after they've hit all of their growth spurts, to see how their spine actually does on its own.
And could you definitely tell if like one of her hips was taller than the other? Would there be treatment options for that, or would she outgrow that too, maybe?
Well, actually, the hip being taller than the other, it makes it appear that way because of the curvature of her spine. So as her spine straightens, that should correct itself. But yes, if she does have to have the back braces or surgery in the future, then that would also correct that. Do you have any other questions, Mom?
No, ma'am. Thank you.
And for the students watching the video, one of the things to remember when assessing a child is always talk to the child. Include the parent in the assessment, but you want them to know that you're actually talking to them. Include them, ask them questions. If they have questions, answer their questions too. Always start by introducing yourself, telling them what you're going to do. Talk about it before you actually touch them. Let them know that you're going to be touching them and what you're going to do and if it will hurt or not. Typically we won't do anything that hurts, but just like a shot, if you were going to give her a shot, you would need to tell her beforehand and prepare the child. You can tell a lot by inspecting, just observing. It starts from the very first moment that you see your client. You can tell a lot by the way she sits when she ambulates from the waiting room to the exam room. Watch for facial expressions, if they limp at all, if they have facial grimaces. When inspecting the skin and the joints, you need to look for redness, any swelling, bruising at the sites, and 2, watch for facial grimacing in case it hurts. Some children may be more reluctant to tell you about pain than others. And of course, palpating, you're looking for any knots, nodules, anything that would seem abnormal. And then upon movement, ask them about range of motion. But 2, don't make them move a joint that is painful or hurt. Wait until the physician comes and examines and possibly does an x-ray. You got any questions, Miss Shelby? All right. Thank you very much today for participating in our video. Thank you.